Hi, Jimmy. Thank you for joining us today on the Learn Engagement Facebook page. It's much appreciated. How you doing?
Happy to be here, John. Thank you very much for
Good.
inviting me. I'm
Good.
good, thanks.
Perfect. So,
How are
guys,
you?
I'm good. Thanks for asking. Yeah, I'm really good actually. So, guys, we've got Jimmy Hunter from Tenants Higgins Trust Scotland here today to talk to us about sexual health, and go into a lot more detail. Jimmy knows so much about sexual health; it's absolutely brilliant. So, I'm actually excited because I don't know anything about it really. So, I'm looking forward to learning as much as you guys are today. Do you want to tell us a bit about your Jimmy self and obviously what your job is and what your role involves, please?
Sure. Well, as you say, I'm from Terence Higgins Trust Scotland, and we are in partnership with NHS Tayside to form the MOT partnership, the Men Only Tayside partnership. So we provide services across Tayside for men who have sex with men, trans people, and non-binary people. However, anybody is welcome into our services, and we will always make sure that we see somebody if it's an emergency. And the type of thing that I do, John, is I provide testing services. Here at the office, our clinic has just opened. We're going to start opening clinics in Angus, so Forfar and Brechin, hopefully each Wednesday as of February. And also, as COVID begins to relax, if you like, I'm hoping that we can restart our campus testing days with you folk.
Okay, brilliant.
And I'm always available business hours. People can give me a call if they've got any queries about anything to do with sexual health, HIV, Hep C, any queries about sexual orientation, gender identification, anything like that. We can be a one-stop shop for all of that. And obviously, I can signpost for further help if need be.
Sounds like a very comprehensive wraparound service. I like it.
Well, we try.
Could you talk to us, Jimmy, about why is it important to maintain good sexual health? What is the importance of having sexual health?
Good sexual health permeates into just about every part of your life. So if you have good sexual health, the chances are you've got good physical health, good mental health, and generally general well-being. Yeah, any of those things that are not happening can lead to other issues. So, for example, if you've got a sexually transmitted infection and you don't get tested regularly, you don't know that you've got that infection. And that could lead to problems. So, undiagnosed STIs can lead to some serious health problems quite the way down the line in the future. Also, it puts your sexual partners at risk. So, if you've got a sexually transmitted infection and you are not having protected sex with your partners, then there's a high chance that you can pass that infection on to others.
Okay.
Um, when there's an infection in the body that's untreated, what happens is that the body's defense system really goes into overdrive to try and fight it. And what that does is that it increases the amount of white blood cells in the blood to fight off the infection. Opportunistic infections like that, especially HIV. So, if your body is continually trying to fight off infection, it will begin to wear you down. And
Okay.
that in itself will have an effect, and it'll make you more susceptible to other infections as well.
So it actually makes you more at risk of other infections well because of your white
It
blood
does.
cells. Okay, that makes sense. Yeah. You also mentioned there that if you're not getting tested regularly, these things can happen. So obviously that explains the importance of getting tested. But you want to expand on that and tell us why it's important to get tested regularly.
Well, building it into your normal daily routine set of activities, whatever you might call it, is really important for a few reasons. One, to keep yourself healthy, keep your sexual partners healthy, and reduce the risk of passing anything on, but also to reduce the stigma. We see a lot of people who are quite ashamed, or sometimes we get people who are quite ashamed about the fact that they have to do a test. They have to do a test. And what we say is, this is good. We're glad you've come to see us. Come and see us regularly. So if you're having two or three different sexual partners in a 3 month period, come and see us every 3 months. Because when you think about the window periods for infection, With some of them, it's 4 weeks. With some of them, it's 3 months. With some of them, we'd want to test after 6 months. So if you are having sex and you're not having sex with a condom, if you're engaging in vaginal sex or anal sex without a condom, then we would definitely want to see you very regularly.
Okay, okay. I
Does that make
suppose,
sense?
no, I totally agree. And I think that given the current global pandemic going on, testing's always become a lot more kind of mainstream, isn't it? I mean, whether you agree with it or not, it is something that is necessary to assess health on a regular basis, and that shouldn't be any different for sexual health, I suppose, as the case may be,
It's one of the things that I think is a positive, if you'll pardon the pun, coming out of the pandemic, is that people are actually used to lateral flow tests. And in principle, they're the same as the HIV tests that we use in the clinic. They're
Okay.
instant tests. They test for HIV antibodies. And I have one here. So all we do is a quick finger prick with that. We scoop up the blood in the end of this, put it in here, and then the same as your lateral flow test. Don't know if you can see that.
Yeah, I can, yeah. It's got 2 lines, yeah.
You get one line for the control line or 2 lines for a positive test.
Okay.
But in this case, because it's an antibody test, we wouldn't say positive, we'd say reactive.
Right.
So any kind of reactive test, we send the client right up to Sexual Health Services at 9 Wells to get a full screen. And where there is an STI present, so chlamydia, gonorrhea, syphilis, the person is put onto treatment straight away.
Okay. I mean, just seeing the comments there that Jude, who's in our team, one of Ellie's in the team, saying it's very interesting. It is interesting. I've no idea. I've never seen a HIV test. I'm totally clueless. So this is interesting for me as well as it should for you. But it's fantastic. That's so simple
It's
to
very simple.
yeah, very simple, and you could find it straight away just to get that peace of mind, So that was very interesting. Thanks for going through it with us. That's really good. Obviously, that's one of the tests you mentioned. What should you expect when getting tested overall in general for different kind of sexual infections?
We would do an instant blood test for HIV
Okay.
and syphilis. Again, it tests for antibodies. What I will say to is that if someone tests positive for syphilis, goes on to treatment, gets cured, the antibodies could stay in the bloodstream for a number of years. So
Okay.
when someone goes for a sexual health test, it's important that they tell the person who's doing the test that they've previously tested positive for syphilis or been treated for syphilis, because the antibodies could still be showing up in the bloodstream. It doesn't mean to say that the virus is still active. It
Okay.
just means that the antibodies are still there.
I think that's an important distinction to make, isn't it? The antibody there, but you don't have syphilis. It's in your stream, but you're not infectious, I suppose is the term. Is that the correct term? Or
Yeah, it
yeah,
is. It is. And a lot of the other tests, when someone comes in, what we do is a consultation. So we try and assess what their sex lives have been like. So how often are they having sex? Are they having sex with what gender they're having sex with, and the type of sex and the regularity of it. And we'll do a quick assessment based on that and decide what tests are absolutely necessary. Standard is an HIV test and a syphilis test. And what we do to test for chlamydia and gonorrhea, there are 3 different ways that we can do that. One, for men, it's or anyone with a penis, it's pee in a pot,
okay,
and that gets sent away to the lab. And again, I go back to what we're all used to now with, as a result of COVID and lateral flow tests, is using a swab.
okay,
Okay, so infections like chlamydia and gonorrhea stay where they're put. So if there is a bodily fluid, or even if a penis has chlamydia or gonorrhea in it or on it, it can transmit that infection, and the infection will stay wherever it's put. So that could be in any orifice, the vagina, the anus, or the mouth. And then obviously it could be in the urine as well. So it's really easy, John, and we don't do this. We ask the client to do this themselves.
Okay.
It's just a swab down each side of the throat. Yeah, couple of swipes, and then back into the pot. We use a separate swab for an anal dip, and you would insert it about that much,
Okay.
swirl it around, and again put it back, and we send all those off to the lab for testing, and that's how we do those tests.
Yeah.
If they came back reactive, again, we would contact the client directly and fast track them into sexual health services at 9 Wells for treatment.
Yeah. Which is good because, as you said, if these conditions left untreated, they can cause damage to your other parts of your health ongoing. So
Yeah, and it goes back to what I said previously. Why wouldn't you do this? Because all these services are free.
yeah,
You are being very proactive in. I'll use the term sex positive, but you're being very proactive in taking care of not only your sexual health, which could potentially impact the rest of your general well-being, but also you're taking care of your sexual partner's
of
sexual
course.
health and
Yeah.
well-being as well. And you are respecting them by making sure that you are as fit and healthy as you can be.
Yeah, this is the thing with sexual intercourse. It is a partner sport, so it's not just your own health you're looking after the health of your potential partners in future, so and previous partners based on obviously when you get
Exactly.
tested. Yeah,
And just remember, if they don't have to not say no in terms of consent.
of course, yeah, absolutely. Do you want to talk a bit more about that in terms of what consent is? Because obviously it's something that you're very knowledgeable about as well.
It's a subject that's come up quite a lot. And again, when we talk about the concept of consent, we also relate that to sexual health. But consent is exactly what it says. Both parties agree to the sexual activities that are going to take place. Just because someone doesn't say no, it doesn't mean that they're agreeing to what might be happening, because many people might feel that they're not in a position
Yeah,
to reject the situation, and that should never be the case. That
of course.
really shouldn't ever be the case. And people who are victims of rape and sexual assault are not the most likely to come forward for a full sexual health screen, because obviously they've got so many things going on in their minds about what's happened to them. Again, we go back to making sure that the health of the person is the prime concern. So,
Yes.
there are sexually transmitted infections at the moment that we've been notified of that are antibiotic resistant.
Okay.
So there's a strain of Shigella, which is an STI, and that has some of the same symptoms as an upset stomach.
Okay.
So we have had cases where someone's had an upset stomach and they just think it's something that they've eaten or drank, and no, it's an STI called
Okay.
Shigella. There have been notifications about a strain of gonorrhea that's resistant to antibiotics. So the more we find out about different strains of these, the more we say to people, just build it into your routine. Wherever you are,
Yeah.
contact a sexual health service and build it into your routine.
Yeah. Well, even just there. Sorry, on you go. I thought,
It's free and it only takes half an hour.
yeah. There you go. For example, Shigella. I don't know pronounce it. I'd never heard of it. So I'm totally ignorant when it comes to sexual health myself. I'd never heard of that before. I mean, imagine everyone knows syphilis, HIV, gonorrhea, chlamydia. Are there a wider variety of sexually transmitted infection disease out there that we're unaware of?
I would include Hep C in that. And Hep C, we normally do a test for Hep C if there is evidence of injecting drug use, but any kind of drug use and sharing equipment has its risks as well. So if you have a banknote or a straw that goes up one nostril, it could create a scratch, so there could be some blood
Okay.
on the end of that. And if that goes right into another nostril, then there could be a risk of infection of
Right.
HIV and Hep C there,
Okay.
for example.
Yep. Now you mentioned obviously on that obviously victims of sexual assault are very unlikely to, or less likely to come forward to actually receive sexual health testing. They've gone through enough trauma as it is. I mean, I can understand that. Are there any other groups who are less likely to come forward to receive sexual health testing that you want to discuss?
Historically, we see trans and non-binary people not engaging in sexual health. And the Scottish Government did a report, I think it was 2 years ago it came out now, but that followed on from a report that Stonewall Scotland did a few years before that, that evidenced that a significant number of trans and non-binary people would not seek out any healthcare for fear of prejudice. Many of those people had experienced prejudice within whatever healthcare system, be that dentistry, going to the GP, going to the hospital, being misgendered, people of the same gender in a relationship not being acknowledged as being in a relationship. So, oh, is this your friend? Is this your brother? Is this your sister? No. That kind of thing. And there is a general skepticism that that kind of thing will happen. And what I say to people is, we understand that. And that's not good enough. And we are trying to change that. The services that we run here in Tayside are open to everybody. So I don't want anyone to think that they have no route and no way to actually contact someone and discuss stuff like this, because they do.
Absolutely. Yeah. Thank you. That's very interesting. Thanks for sharing that. Obviously, in times past, you've always had your drop-in clinics at the college that have been accessible to students. With COVID restrictions, obviously, it's not the case just now. As they hopefully ease in the future, I mean, I think everybody's on the same page, hoping that these ease as soon as possible and that we can return to some sort of normality in a safe manner, of course. Can you tell us, obviously, what these drop-ins include? Because we are hoping to obviously start these again once we have the restrictions reduced.
At the moment, the drop-ins would be appointment-based, and the appointments are half hourly, and we need time to clean whatever room we're in after a client has been in. And people need to wear a mask. And that at the moment is it. Those are the requirements. Obviously, there's the standard set of requirements that if you've been in contact with someone or you're isolating or so on and so forth, we go by the standard set of regulations that are issued and updated by the Scottish Government, and our risk assessments are all based on that as well.
Okay. And in terms of outside of COVID, what can someone expect when they come to one of those drop-in appointments? What would the process be from booking online? Obviously, we'd handle that from our point of view. That's our team's responsibility. But once they've turned up to your appointment, what can you expect during that half-hour period or that period with yourself?
Whoever comes into the consultation is free to talk about whatever is on their mind.
Okay.
Yeah, we might do a test, but sometimes, depending on what they say, sometimes we don't do a test, because in some cases people come in to talk about a specific issue that they might have. And that's fine. That's absolutely fine. We're there to do testing, but then, we do a risk assessment. There might not be a need for a test.
Of course.
Are you worried about anything? Is there anything going on? And it's a good opportunity then to actually signpost people to different services and make sure that whatever's going on with them, they are getting the right kind of support and help.
Absolutely. So they might even come at that consultation thinking they need a test, and obviously you'd advise them. Obviously, it's not always the case. So it's good that they can get information and they have that service available to them. As I was said in the comments, there, guys, we'll be sharing dates on that as soon as possible. Obviously, it'd be based on restrictions within the college, but we will obviously share updates with you on the social media pages for ourselves in the college, and obviously in the portal as soon as possible when Jimmy's back on campus off on the drop-in sessions. Is there anything else you want to share with Jimmy? I mean, I've learned a lot already, but is there anything else you need to tell us about? Or
it's just busting the stigma, John. It's just trying to get the message out there and I'm hoping that people kind of equate it with what has happened with COVID. But, you know, if you're having sex with different people, there's no judgment with any of this. There's absolutely no judgment about who you are or who you're having sex with. It's the fact that you are having sex with someone. Great. As long as that's happy and consensual, not a problem, whoever it is. But come and see us for a regular test in the same way that you would go and see your dentist regularly. In the same way that you would hand your Karen for an MOT regularly.
Absolutely. Very, very important. Thanks very much, Jimmy. Really appreciate it. And we're looking forward to getting you back in camp as soon as obviously restrictions ease. I might even come on and visit myself just to make sure. You never know, you know. So
I think it's good leadership if
absolutely.
students see staff making use of the services as well.
Totally agree. Listen, I've never had a sexual test, so I wouldn't know. I could be carrying all sorts of things, but you never know. I mean, but I'll look forward to
Well,
seeing you when you drop in.
maybe on the next live event we'll do a test on you
Live. Okay.
Yeah, live, just to let people see what it's actually like.
Happy to do that. I'll maybe give the anal swab a miss, but other than that, I'll give it a try. Thank you very much, Jimmy.
Fair dues.
Yeah.
Thanks, John.